I'm Meshal Malik, and you're watching Indus Special. One child every 39 seconds dies due to pneumonia. According to this new analysis last year, 800,000 children died worldwide because of this illness. On today's show, we take a closer look at the factors which make children vulnerable and what needs to be urgently done to save lives from this preventable disease. Joining us for this discussion today is Dr. Yasir Bin Nasir, representative of the World Health Organization, joining us from Geneva. Also joining us today is Mr. Edmond Fernandes, community health physician and global health expert, joining us from Mangalore. Thank you both for joining us and welcome to the show. Dr. Nasir, I'd like to begin with you. Now, this new analysis that I'm talking about, in which one child dies due to pneumonia every 39 seconds, it also states that this is a forgotten epidemic. Do you think that is the case, and why so?
There is no doubt about that this is a forgotten epidemic because of the several reasons. As you have aware that there are about 800,000 deaths due to pneumonia every year. And it's not only that, the burden of disease is also very high with all the efforts which we are doing in the last several years. If you see that among those under 5-year-old children, the case of pneumonia among 1,000 children, it's 14 cases per year globally. However, in South Asia, it's a bit higher. It's 25 cases per 1,000 children per year. We have seen some reduction in pneumonia-related death in the last 18 to 20 years, and there is a reduction about 54% due to pneumonia-related death. But on the other hand, if we see that this is not a significant reduction by seeing the other infectious diseases in this age group, like diarrhea, where we have seen that 64% reduction in diarrhea-related mortality in the same time frame. Other reason is that we have seen that this, with all the efforts, it's not only on the preventive side, also on the treatment side, the deaths are still on a higher side. And there are only, if you see in the death proportion, there are 5 countries all around the world which has about 50% of the death. And these 5 countries are 2 in Asia, Pakistan and India, and 3 in Africa, Nigeria, Democratic Republic of Congo,
right,
and Ethiopia.
Right. Dr. Nasir, you correctly mentioned here that only 5 countries are responsible for half of these child deaths due to pneumonia. And 2 of these belong to Asia, India, and Pakistan. And now, when we're talking about this, India and Pakistan having such high rates of children dying from this, of course, we have to take into account the environmental factors contributing to this. Shed some light on that.
We know that there are some risk factors, environmental risk factors, which leads to pneumonia. One of them is air pollution, indoor air pollution, which is actually one of the risk factors for pneumonia. And we have seen that in the last 20 years, the level of indoor air pollution is static in South Asia, despite all our efforts. The other is overcrowding. Due to overcrowding, the basic cause of pneumonia is a viral or a bacterial infection. So with overcrowding and a poor hygiene, there is more chances of getting pneumonia as compared to other diseases. So I think the environmental factor play a vital role here to prevent pneumonia cases.
Right. Now, when we're talking about these environmental factors, and Dr. Nasir told us about the several risk factors that are contributing to this, we're also seeing worsening climate, we're seeing worsening air pollution, all of this combined. Do you think there is a realization amongst policymakers, amongst health experts, that the domino effect this is leading on to the health sector?
This entire statistic points out 2 things. While it's alarming for India, Pakistan, among the Asian region, what we also need to understand is, have the 2 countries sincerely trained parliamentarians in this light? I mean, it's very nice to hear international organizations talking about statistics saying one child dies every 39 seconds, or proportionate to that, 2,200 children dying every day. But how many of our parliamentarians really know what is an action plan or a framework that really needs to be put in place to tackle upper respiratory infections?
Right.
So the starting point for at least India and Pakistan would be that have a special sensitization session for parliamentarians, which then trickles down to state legislatures about what are the policy actions that are possible in this direction.
Right. Edmond, now I detect some sarcasm coming in your tone when you're talking about these international organizations quoting these statistics. Can we dig a little deeper into that? Where is that coming from? Do you think international organizations are also slacking in some regard?
I mean, I would like country governments to look at life beyond statistics, life beyond a number. I mean, look at that child flashing on the screen out there. That child doesn't know what policymakers are talking, what are the current established practices in the respective countries. What we really need to arrive at is how do we become the voice for that voiceless kid? I mean, it's good to have statistics, it's good to have numbers, it becomes a media hype for a few days, but realistically, from a global health perspective, we need to get down to the grassroots, also probably engage parents interaction with grassroots level workers. Like, for example, in India, we call these workers Anganwadi workers. Or you also have foot soldiers in Ashas, who's called an accredited social health activist. I mean, likewise, each country has their own terminology or nomenclature for it. This is where we need to start.
Right. Now, Nasar, going back to you and talking about what international organizations should be doing. Now, after these statistics came out, it created quite an alarm. Many health experts realized that there was an inertia on the global front as well. Of course, as Edmond mentioned, there is much to be done at a country level. But what do you think needs to be done urgently at an international level?
You know, this is a multi-sectoral effort. There are two things to avoid deaths from pneumonia. One is to prevent pneumonia, another is to treat pneumonia appropriate. And WHO has guidelines on both. We have the framework, which is a protect, prevent, and treat framework, under which protect and prevent means to like reducing the risk factors and promoting the good health practices like exclusive breastfeeding in the first 6 months of life, including the appropriate complementary feeding and immunization, not only with the pneumonia immunization, but also measles is very important to prevent pneumonia incidents in these areas. Other is a timely recognition of disease and appropriate treatment. So WHO has the guidance for that, not only at the community level, but at all three levels. And all three levels are at the community level, at the health facility level, which is actually a primary healthcare level, and at the hospital level. It's the difficulty is how to scale up these guidelines at the country level, because we know that in some of the places, the accessibility to the health facility is really difficult. And on there we have, as mentioned before, also the other expert, that we have community health workers, and we have given mandate for some of the cases of pneumonia to be treated by the community health worker without referring them to a higher facility. And we have seen some success also. So now it's up to the countries, especially their political leadership, to implement these guidelines with the help of international organization to provide them technical support. And I think once it is scaled up, we will significantly reduce the mortality due to pneumonia or deaths due to pneumonia. Although we have achieved 50% reduction in the last 20 years, but this process is a bit slower in few of the countries.
Doctor, one thing that I do want to get to is when we talked about environmental factors, I mentioned how climate change is exacerbating many diseases, how air pollution is increasing. That exacerbates many of the issues we see. Pneumonia is one of them. Now, as we're seeing worsening climate, as we're seeing weather patterns change, of course, this is a global phenomena. And the poorest countries are at the worst end of this all. What is being done on the financial end to support these countries? What is being done at an international level to provide funds for support and for development of health facilities in these countries?
You have rightly said that there is a gap in this situation, and we have seen that. I again quote the data because data drives us to go where we are and the future. Also, the environmentals, we have less financial expenditure on environmental, and this is why I'm saying that this is a multi-sectoral approach. It's not only the health can give you some of the guidance, but then we need other sectors to be involved. Educational factor and environmental sector, we need to involve them, and we need to involve international organizations also to provide them technical support, also the financial support if needed. Alone, to prevent pneumonia cases alone by health sector, it is quite difficult. So we need a multi-sectoral approach to reduce this disease.
Right. Edmond, now you mentioned how there needs to be greater awareness amongst parliamentarians. That's the first step, to sensitize them to the issue, to get them to be aware what is actually happening. Now, when we're talking about these issues, we do know that some people are more vulnerable, especially those belonging to lower income backgrounds, those who are more exposed to the environment. Greater risks are, of course, they're burdened with them. Now, in all of this, what do you think practically can happen and should happen urgently?
So it's quite simple. I mean, if you look at the number of children dying with regard to the amount of spending, it is pro-poor. And this protects the poverty that already exists. So one is to step up investment in terms of both government investment in healthcare and at the same time investment in healthcare through the private sector. Now, I'll give you an example. I'm associated with an NGO in India called CHD Group, and this organization works in the space of public health with malnourished kids. So let's think about this as a policy strategy. Why not the government step in where you're already working with malnourished children? So bring accountability in scaling it up further, saying that, okay, you also ensure vaccine coverage is there in terms of pneumococcal vaccine. And there's also timely reporting done, both from the government medical officers and also from the private practitioners in terms of notification of the disease. This would be a very small step, but it would go a very long way in changing the futures of countries, particularly Asian settings of India and Pakistan. Of course, West Africa would require a more concerted approach, a more detailed policy change coming into what already exists. But at least these are certain small changes that can be adopted.
Right. On that point, thank you so much, Fernandes, for joining us from Bangalore. Dr. Nasir, that is an interesting point that Edmond put out, that we're not looking at these opportunities of investing and participating, collaborating with private companies, trying to bring them into the loop, trying to expand this network. What do you think needs to be done at an international scale, trying to localize it in order to create this culture where it's not just the public sector that is trying to strengthen the health facilities, because this is, of course, a systematic problem?
Yeah, thank you. We know that in Asia, we have a very strong private sector also, and research has shown us that more than 70% actually take care from our care seeking from private sector. So that is why we need to make these private sector to be part of this whole approach. However, we need a good legislation to standardize the treatment in the private sector also. We know that we have many GPs and somehow in Asia where they are closer to home and people used to go there for care seeking. But the standard over there and the quality of care they are providing, they are somehow not up to the mark. I'm not saying that we cannot improve it. We can improve it. We need a good legislation, and we should involve the private sector whenever it is possible. But having said that, we need a good legislation also how to standardize treatment at the private sector, because I have seen that in private sector there is no standardized treatment. They are giving from low generation or the first line antibiotic to those which we call as third line antibiotic, which should not be used in a simple pneumonia cases, and they are using that. Sometimes unnecessary, they are doing hospitalization which don't need it. So that is why I'm saying that we need a good standardized approach and good legislation to standardize treatment at the private sector also.
Right. There were recent figures that indicated that if we don't try to extend our health coverage of people, especially for those who belong to the lower income backgrounds, we don't move towards universal health coverage, almost 500 million people will be left behind from this envelope. Now, when we're talking about all of this, how far along do you think we've come in being able to provide accessible and free healthcare all across the world?
I have told you that in those areas where hard to reach areas where the accessibility to the health facility is quite difficult, WHO along with UNICEF recommend community health workers to be there and train them to treat simple pneumonia over there and other diseases also in childhood. So using that approach, there is ample evidence from the research which has shown us that community health workers can reduce, if they are trained and provided with the logistics like antibiotics and other equipment, they can reduce pneumonia-related mortality. And I think in those areas, we should use community health workers in almost now many of these countries like India, Pakistan. In Pakistan, we have Lady Health Workers Program, which is a very successful program. So we can utilize those lady health workers, which is actually closer to home for the treatment of pneumonia. And they have doing some of great work in Pakistan in reduction of mortality in childhood related to other diseases like diarrhea and somehow to pneumonia also. So one thing is strengthen the community health workers program to improve the universal health coverage. At the same time, we need to strengthen the public sector health facilities at the primary level so that it can be accessible and the quality of care should be improved over there. And lastly, we have to improve the quality of care at the hospital level also.
Right.
So combining all these three together, we can improve the not only
right.
the
Dr. Nasir, those are all very important points you've highlighted, but I also want to introduce another guest who's just joined us, Dr. Sonya Saleem, who's a general physician joining us from London. Thank you so much, Dr. Saleem, for joining us. Now, what I do want to get to is for parents to be able to identify, for parents to be able to understand what pneumonia is, identify when their children is suffering from it, what they can do, and to understand that it is a preventable disease. Dr. Saleem, take us through some of those basic things.
So in the UK, we have a national immunisation programme which starts shortly after a child is born. And essentially, the child will start to receive vaccinations, for example, against measles, mumps and rubella. Now, one of those vaccinations is known as the pneumococcal vaccine. Now, this helps to prevent against certain strains of pneumonia. So this is a very, very good way of, setting a good start, for a young child. I mean, obviously, it's not going to protect against all of the strains of pneumonia. But unfortunately, what we are noticing here in the UK is that there has been a downward trend in the number of parents actually allowing their children to be immunized for whatever reason. And we've started to notice that incidence of disease, including measles, has been a resurgence, especially in the London area, but also rates of pneumonia have also started to increase. So, we need to tackle this at a local and a national level. And also just simple things, especially for first-time parents, recognizing the signs and the symptoms of respiratory distress, because at the end of the day, these are children. They have a weakened immune system in comparison to us adults. So, simple things such as seeing whether the child is making an increased respiratory effort. For example, if there's any nasal flaring, if the child is not feeding as well, they really should be going to see their general practitioner, because it's better to nip these things in the bud before things get a little bit too serious.
Right. Now you're saying these things need to be nipped in the bud and parents need to understand. You also mentioned first-time parents. Take us through some of the more essential things that they do need to keep in mind in terms of respiratory diseases in the first couple of months when their child is born. The care they should take.
Sure. Of course. So if a child has been born prematurely, so less than the usual 37 weeks, then they're at a slightly higher risk of developing, let's say, chest infections or infections anywhere else in the body. So these parents need to be even more vigilant. But in terms of respiratory rate, if the respiratory rate is more than 60 per minute, or if there are any signs of respiratory distress, for example, if the parents move a little bit in and out, if there's any sort of chest indrawing, if the feeds are less than 50%, if the child is coughing, these are all all kinds of indicators which suggest that the child needs to be taken to the general practitioner as soon as possible. Obviously, if the child has other comorbidities, other medical problems, then parents should be taking their children to be seen by the general practitioner much sooner.
Right. On that point, thank you so much, Dr. Sonia Saleem, for joining us from London. And thank you, Dr. Yasir Bin Nasir, representative of the World Health Organization, joining us from Geneva. We're going to go for a short break. When we return, we take a close look at how, despite international claims to end the practice of child soldiers in many conflict zones, the numbers continue to rise. Stay with us. Welcome back. Now, war and conflict gravely increases the chances of children being exploited. One of the many ways this is done is by taking child soldiers into military ranks. Now, the world largely has come to an agreement regarding how there needs to be an end to recruitment of child soldiers. But has that understanding, in fact, changed the threat children face during times of conflict? That's our discussion today. Joining us to explore this is Mr. Fadel Abdul Ghany, chairman and founder of the Syrian Network for Human Rights. He joins us from Istanbul. Also joining us is Ms. Juliette Touma, spokeswoman of UNICEF, she is the regional chief of communications at UNICEF Middle East and North Africa. She joins us from Amman. And Mr. Pattrick Oyet, who's our correspondent, joining us from South Sudan. Thank you all for joining us and welcome to the show. Ms. Touma, I'd like to begin with you. Now, children continue to be disproportionately affected by armed conflict in many parts of the world. But when we talk about child soldiers, how is the impact of this different than a child who is living through conflict?
Yeah, so I think, thank you first of all for dedicating the time for this. And I think given the high number of conflicts in this region, we have seen a significant increase in the number of children who are fighting. That is the case in places like Syria, but also in places like Sudan and Yemen, and to a lesser extent in Iraq.
Right, and you're saying numbers continue to increase. I also talked about how an agreement has been made between governments, how governments have tried to pledge that they will reduce these numbers. Yet we're seeing these numbers continuously increase. Why do you think that is?
Because of the conflicts. I mean, the armed conflicts in the places I mentioned have meant that more families, in fact, have become poorer. And one of the reasons why families push their children to be recruited into the fighting is the socioeconomic situation. In many cases, families cannot make ends meet in places like Yemen, like Syria, like Sudan. And so there is an economic factor to why children are pushed into armed conflict.
Right. Of course, it's a very complex sort of a situation, one that has many factors leading to the end result. I'd like to talk to Mr. Oyet about South Sudan. As Ms. Touma mentioned, that we are seeing numbers expand within Sudan. UNICEF also reported that at least 19,000 child soldiers still remain to be within Sudan. What do you think are factors unique to this region that are contributing to military ranks continuously absorbing child soldiers?
Yeah, there are many factors. You know, if we are talking about child soldiers in Sudan and South Sudan, there are very many factors. It may need me to go a little bit back in time. For example, the 21 years war between the southern region and the northern Sudan was actually, you know, something that took so many years. So many people in the southern region joined the fighting, and children also, some joined voluntarily, some because they lost their parents, they didn't have anybody to take care of them. They went and joined, you know, the military, and they were fighting. That's why there was a name for the child soldiers, which was known as Red Army or Jesh Amer in Arabic in the Sudan here. Now, some of those people have now grown up, they have become adults, they are men and women, but even in the current conflict where, you know, for 5 years South Sudan has been at war with itself, beginning from 2013, so many children have also been pushed to join the armed groups. Some joined voluntarily because they lost their parents, they didn't have anyone to take care of them, they saw their parents being killed, and they joined as a means to, you know, also carry out some form of revenge. Some were abducted. They were not willing to join the armed groups, but they were abducted. At first, they objected to this, but, you know, as time went on, some of them became used to this because they found some kind of freedom. If you wanted something, you could take by force. Yeah. So yes, those are some of the factors that push actually many here to go and join these armed groups. And if I may continue. Now, as the peace agreement was signed in 2018, now there are provisions in the peace agreement. For example, like the soldiers of the opposition are supposed to be kept in some camps known as cantonment sites. Now, opposition and okay, all parties started, you know, recruiting more as people moved to the camps, so that, you know, the tyranny of number. Somebody wants to say that we have this number of soldiers. They don't care whether they are children, whether they are adults. So they were just recruiting people to make sure that they have the numbers, so that they say, you know, we have a big force, so you need to give us a big portion in the government. So this also, according to UN, United Nations Human Rights Commission in South Sudan, they have reported that this peace process, the fact of people getting cantoned in the sites, have also forced some armed groups to continue to recruit children. Not only that, even at the present moment in Sudan and South Sudan, there are wars going on. There are groups that are not party to the current peace agreement, and they are actually still recruiting people, including children. So it's a big factor in this region.
Right.
Yes.
Right. Ms. Touma, going back to you and talking a little more about child soldiers and talking about gender involved in this. Now, of course, it is true that it is not just boys who make up or constitute the number of children who go into these military ranks. Young girls also constitute a large number of these people. Give us a sense of that. Expand on this, the nature of the tasks that are involved when these children join these ranks.
Okay, well, so when it comes to the region I cover, the Middle East and North Africa, it is largely boys. There are some girls, but the numbers are much less. And normally it is adolescents, so ages 14 and above. But the problem is that because of the escalation of violence in places like Syria and like Yemen, we have seen children as young as 7 years old getting recruited to the fighting. And so this is absolutely unacceptable at any age, but let alone at that tiny age. Now, there are huge consequences as well on children who get recruited into the fighting. I mean, the psychological impact that this has on children is huge, and it also has long-term implications on the well-being, on the health of these children, especially because what we have seen in this region is a transformation in roles, in the sense that while in the beginning of these crises, The children were being used in secondary roles as porters, as cooks, as medical assistants. We have seen gradually a change in that role to children taking a much, much more active role, children carrying weapons, children being trained on using weapons, including in some occasions heavy weapons, and children in extreme cases were used as suicide bombers and as killers.
Right. Now, the number of things that you've mentioned here, the reasons why children are brought into military ranks and what they are expected to do. Mr. Fadel Abdul Ghany, as we have been talking, in Sudan, we're seeing expanding numbers of child soldiers, but this is also the case in Syria. As the conflict becomes more complex, as it continues, of course, the situation intensifies. There are more and more casualties. But we mentioned that many children voluntarily join as child soldiers. What do you feel like in Syria is the situation when we talk about these increasing numbers?
In Syria is more complicated because there is several perpetrators. At the beginning, we are talking about the state, which is Assad regime, and the non-state actor. And those also non-state actor also is a various level. So if we go to the Assad regime, which start hiring the children at the early stage of the conflict, even before there is shortage in his forces, by hiring some local militia, and those militia also carrying a sectarian touch, we noticed that there is a lot of children in between, and that's increased and escalate the conflict itself. If we move to the non-state actor, there is some types of centralization of some actors, like the Kurd forces. This side you can talk about, you can impose sanction, you can pressure them. There is structure. So those, for example, supported by the U.S. Government. And we keep actually pressuring that the Kurd forces is still hiring and recruiting children, and also sometimes kidnapping children because they have lack of forces. If we move now toward the extremist group is something totally different. This hiring children since early ages actually, and they start ideologically teaching them. Here, how you can deal with this phenomena is something different than the government and the center body like the Kurd forces, but voluntarily.
Mr. Ghany, you mentioned several points here, but one of the important points that I want to pick up, and I want to refer this to Ms. Touma, is how Mr. Ghany talked about some parties, some will come under the pressure of sanctions, that will come under the pressure of international talk. Now, Ms. Touma, as I mentioned before, we talked about how international organizations, how international partners, how countries have come to the agreement that this is wrong, that they want to stop it. But practically, in violence and conflict, the situation gets so complicated that it is not easy to actually determine what are the laws and legalities. Can there ever be an end to child soldiers until there isn't an end to conflict?
Look, I mean, even wars and conflicts, they have laws. I mean, there is the international humanitarian law, there's international human rights law. They were actually put in place because of conflicts and wars around the world. And so the laws are very clear. Children should not be recruited into the fighting. It's very, very clear. And so this should not happen. Children belong at home where they're safe with their families. Children belong in schools where they can get educated, where they can flourish, where they can prosper to be the good adults that this world desperately needs. And so the rules are really clear, and it is actually a grave violation of children's rights to recruit children into the fighting.
Right. Just before I let you go, I want to talk about the rehabilitation process. Now, UNICEF has worked to recover, to bring back into society many child soldiers. What is the process of rehabilitation like?
So it's actually one of the great things that this organization that I work with does is the rehabilitation of children who have previously fought and reintegration into societies, like you said. And there is a very long and detailed process on how this can be done. The bottom line is that it can be done. So there is hope for children who are forced and who get exploited to fight into these wars. And so there is the psychosocial or psychological support that is given to the child so that he or she can get out of the initial shock and trauma of what the recruitment and the fighting did to them. And this is obviously a huge and very important part of the process, and that continues along the way. And there is the reintegration back into society, whether reunification of the child with their families or finding other safe places for the children for the child to be reintegrated in a society, and then eventually, obviously, getting back the education. Most children miss out on their education, so how do you rehab that part as well? And then there are many success stories and there are many good stories, and the bottom line is that we shouldn't give up on these children. We are talking right now about tens of thousands of children who are in places like Iraq, in places like Syria, who come from areas formerly under armed groups. They should go back home and be reintegrated in their societies. The Syrians and the Iraqis among them should also be reintegrated. The bottom line is they are children, right. And this is something that we should never ever forget.
Right, and that is a bottom line that needs the most emphasis. Thank you so much, Ms. Juliette Touma, for joining us and talking to us. Mr. Fadel Abdul Ghany, as Ms. Touma said, the bottom line is that these are children. And as you talked about, the Syrian conflict is one that is extremely complex. What we hear about is civilian infrastructure being targeted more, is child casualties rising. As I mentioned before, international law exists, talking about it, the conversation exists, but implementation doesn't seem to exist. Do you feel like the world is coming to a recognition that as the casualties rise, there needs to be an understanding that these are children, that something more needs to be done to protect them?
Actually, we hope so, but like the implementation is something different. Of course, there is the international law, the international human rights and international humanitarian law, but and everyone is knowing those like rules, but no one is like at least implement those rules even after signing the convention, or there is the custom law actually. So that the thinking should move ahead. How we pressure those perpetrators to implement. This is the key issues. For example, now when the Assad regime does not even respect all the Security Council resolution without any further like movement from the international community, how he does respect the recruiting children or not disappear them or abuses against children. Even SDF, if they like the international coalition is still like funding and without any pressure in this regard or real pressure. There is some types of talks, but that's not enough. The level of pressure should be like matching the scale of violation. This is the key issues. And I agree with you totally about also the conflict. When the conflict is continued, so this is the main issue of the increase of using the children. And the children themselves also, they lost more of their parents. They lost more of their schools.
Right. Mr. Ghany, stay with us. I want to move on to Mr. Pattrick Oyet and talk to him about something that I was talking to Ms. Touma about, the rehabilitation process. Now, Mr. Pattrick Oyet, in Sudan as well, we're talking about this country having the highest number of child soldiers. When they're brought back into society, how is the process of rehabilitation?
This is where the biggest challenge is because, for example, UNICEF says it has at least returned home more than 3,000 children. But when these children return home, especially in the southern part of southern Sudan or South Sudan, the challenge is that psychiatrists are almost not there. The only practicing psychiatrists in the country are actually only 3 in a population of 12 million. That is in the South Sudan. So you can see the the challenge there. So these children, when they come, the social support to really support them to, rehabilitate to the society is almost non-existent. There are some non-governmental organizations that are trying to provide this kind of support, but also they are overwhelmed because you have a situation where, as you mentioned earlier, 19,000 child soldiers are there. There are some who are returning home. But remember, these are only the counted ones. There are those that are even not yet counted. So the number is big, and the medical personnel supposed to help them to rehabilitate back to the society are almost non-existent. It is a very difficult situation, and that's why some of them who even are brought back to the society, they find it difficult to live because they have not gotten the treatment they are supposed to get. And sometimes they go back to the armed forces because they feel the armed forces are actually their home. They are more used to the members there. They have more freedom there. They can go and loot.
Right, Mr.
They can go
Pattrick
and do. They have
Oyet,
a lot of.
Sorry to interrupt, but you mentioned something very important, and this is where I want to end the show. You mentioned how because of the systematic failure of not being able to reintegrate them back into society, they go back to being child soldiers. Now, tell us, what do you think needs to be done by the international community at large that talks about this as being a grave issue, a grave violation of human rights?
Yes, first of all, there needs to be, of course, the legal system have to be strengthened. The legal systems have to work. But the unfortunate thing in this is that, when you are in a situation of war, the rule of law collapses, accountability collapses, and, there's no constitutionalism. So it becomes a little bit difficult. But the best thing is to strengthen the rule of law, to strengthen constitutionalism, and to make sure that the justice system works so that those who are recruiting child soldiers, if proved that they have been doing so knowingly, then they should be held accountable. That is the only way to, to try to arrest the situation. Otherwise, if you have a situation where the legal system is not properly working, then people will continue recruiting, and the only thing they can get is a peace agreement that brings them back to the government, and they are actually rewarded with big government positions. So they don't see a problem in that because nobody is holding them accountable. So yes, the legal system has to be strengthened. It has to work, and those who are responsible for this violation to be held accountable. Thank you.
Right. Thank you so much, Mr. Pattrick, for joining us from South Sudan. Thank you so much, Mr. Fadel Abdul Ghany, from joining us from Istanbul. We've run out of time for this show, but we will see you next week with more stories. Till then, goodbye and take care.